So you're doing everything right, but then bam, your teen's symptoms come back. Well, it feels like you're back to right at square one. However, let me tell you something, that this does not mean recovery is not happening. In fact, setbacks or flare-ups or symptoms coming back, whatever you want to call it, are actually part of the recovery process. So the key is not about avoiding them at all. It is actually knowing how to handle those setbacks and flare-ups and symptoms so then your teen keeps making progress instead of getting stuck again. So today, I'm going to show you exactly how to keep your teen on track, why setbacks don't mean failure, and more importantly, how to make sure progress does not stall, and the mindset shift that makes all the difference between you and your teen. So let's dive in. Hi, my name is Dr. Ellie. I'm a pediatric health psychologist and the founder of Teen FND Academy. I have helped hundreds of teens with FND and their parents get their lives back because they are able to resolve the condition of FND. So if you know someone who is struggling with FND, please hit the like button because it helps YouTube know this is important video and it is going to help us get more awareness about teen FND. So back to the video. Number one, setbacks are absolutely normal. It is actually the time for you to not panic. Okay? Because the recovery is never ever a linear straight line. Symptoms can flare up, which might seem like you're having a setback. But let me tell you, as long as your teen is working on the skills and strategies that I talk about on this channel over and over again, so the time plus the skills and strategies, then any flare-ups or symptoms or setbacks that you call it is actually part of the adjustment period, because anything and everything is all leading towards a recovery. I can also tell you that if you're not doing anything for whatever reasons, not practicing skills or strategies, just time, then yes, it is called setbacks and flare-ups. And then every time it happens, gradually it's gonna get worse and worse and worse over time. That is the name of the game when it comes to FND. However, as long as your child is practicing these skills and strategies, then really the brain is basically still learning even though when symptoms return. So it's not just about the symptoms that we need to focus on. In fact, I tell all my teens and parents to really stop measuring and stop counting all the symptoms that happened during the adjustment period, because what is more important is something they have control over their body at that time, which is how to respond to that flare-up, not so much about how to avoid or prevent them. So it's really important for you to know that setbacks are sort of like a data and opportunity for these teens to practice the skills and strategies. So don't worry, don't panic. Setbacks are actually part of the adjustment period. Number two, to stay on track, you have to keep the routine going. It's almost like building a muscle. And if you stop working out, your muscle doesn't keep it up, right? You kind of have to maintain it. The same thing. This is what I see all the time. One of the biggest mistakes families make is stopping their recovery work way too soon. It's like, oh my gosh, out of sight, out of mind, especially when things get better. So like this, my child has not had seizures and functional seizure symptoms in a week. Whoa, this is great. It never happened. And then they stop doing everything. Again, there is one side of it. And then the other family who's on the same path, yep, it's been a week since we haven't had any symptoms or setbacks, but we remember everything is adjustment period, so we're just gonna keep going. So this family kept practicing daily movement, routine, nervous system regulation strategies, and the mindset work even after symptoms improve. Because remember, we're not measuring the progress by the symptom or the lack thereof. We are measuring the progress by the level of functioning, anything and everything your teen wants to do, and then you are back to your life again as well. All of those things are the important measure of progress and success and improvement, not the symptom. So take Ellie, for example. She was a high school senior when she got diagnosed with FND. So her symptoms of the FND was non-epileptic seizures, PNES. And this family reached out to me initially, but here's what happened. Parents had a hard time wrapping their mind of the FND concept and diagnosis because of the lack of knowledge, like everybody, right? So then what happened was that they went to the route of conventional medical model, which is go see a therapist, go see a cognitive behavior therapist, oh, do this physical therapy, and stuff like that. And then family was adamant about using their insurance option. Great. So they reached out to me and we talked about my program, and they chose to go somewhere else because they wanted to use this insurance. And then let's just see, maybe my daughter prefers to see a therapist in person rather than online. So all of that stuff. Guess what? This child has seen this so-called therapist who was not even an FND specialist for almost a year. And parents were so patient enough to wait and see how this goes. Guess what? It kind of went up and down, and then there was a moment like towards the end of the year that she was actually doing fine. And then so they were believing, oh my gosh, this therapy, whatever she was doing is working. Great, right? I'm like, okay, fine. And then after the New Year's winter break, bam, it hit this child harder than ever. Having these functional seizures episode, one after another. Remember, that's a huge setback. And turns out this therapist wasn't really helping the child. And so parents became so panicky and concerned because now this is like the last semester of this child's high school years, and they were so terrified whether she could actually graduate or not. And that's when they came back almost a year later. You know what? We know that you help teens with FND left and right, and they all get better. And what were we thinking? But now we are ready. Yes, do whatever it takes to help my child. And I'm like, of course, I'm happy to help you. So we started working, and within 3 months, she was completely symptom free. But once again, symptom is not how we decided to measure the progress, right? So she was actually starting to go back to school all day, every day with the baby steps. But eventually that's what happened. And she was doing a lot of deep work about the nervous system regulation strategies, starting with knowing exactly what she was dealing with, what FND was, what it was not. And she worked on a lot of mindset work, which is a hero mindset. See, she was very passive in terms of her treatment up until that point because parents were the ones who were sort of running the show, and for the right reason, right? And then so the child was like, well, I don't know what's going on, so I'm just going to follow whatever you need to do, right? That kind of thing. So I said, look, if you want to get better from FND, then number one, you have to feel like you're in better control about yourself. Not about, oh my gosh, and I can do anything and everything I want to do, kind of thing. No, you are going to have a control that comes with the responsibility. But I want you to start taking over all of the decision-making strategies about your body, starting with the mindset and then practicing the strategies and the daily routine, set the goal, all of those stuff. So we had a lot to work on, but we went through that, and then she got better, right? And then the parents are like, oh my gosh, she's so much better. And then they almost wanted to stop the treatment right there and then. And I said, you can do that. However, if you want to get better from FND once and for all, then we still have this piece left, which is the why phase, why she was having FND in the first place. Without that, I guarantee you that you're gonna get better, but then it's gonna come back. And this is exactly what happened to so many other teens I have worked with. So she was like, okay, no, I really want to be done with this because I have an important thing to do, which is to go to college. And she actually wanted to go to this dream college and she didn't want to give that up. And so I said, okay, great. And we have time to work on that. So we kept going, even though she was fully functioning at that time, back to playing soccer and having fun with your friends and all kinds of stuff. So we literally worked through that. And guess what? She is not only symptom free, but she figured it out why she was having FND in the first place. And guess what? She wrote me this like beautiful letter saying like now she's in this dream college, working through her college and then having fun. And she is literally a happy camper. And her parents are literally in tears. Oh my gosh, we got our child back. What more do you want for your child to have a successful, happy life? But here is the deal, which leads to the third point, the power of mindset and the long-term growth. See, my approach is not about quick fix, band-aid, temporary solution. So not that I don't care, but I don't pay too much attention on when parents ask me, oh my gosh, my son just had an episode, what do we do? No. That's too reactive. I want all of us to be proactive because it's really about learning and building lifelong skills and strategies and resilience. So I am all about that. Therefore, we always start with changing this mindset from the victim mindset to a hero mindset and choosing progress over fear, even when it's uncomfortable. And it's not the same thing as like you just keep pushing, kind of thing. No, you have to know how to pace yourself, right? And then you have to know your limit. However, challenge yourself 1% at a time every day. And that's why these families in my program do so well, because they really start with the ground up building strong foundation. They are not looking for the short-term temporary fix. So that is how successful families are going to be like. And therefore, these families stay in touch because they like to have this community of support. Everyone is working towards a solution, not staying in this doom and gloom whining phase, aka the victim mindset. They are more about what can we do so we can take action and then we can resolve this once and for all and get our life back, because they've got other important things to do. And therefore, they don't feel alone in this journey when there is a community. And I have seen it time and time again. When these teens are working in the community, they heal faster. And I know why, because they are inspiring with each other instead of pulling themselves down with each other. So again, setbacks are normal, but do not panic, right? And then number 2, keep the routine going even though things look better, right? And number 3, really start focusing on the long-term growth and resilience over short-term temporary Band-Aid situation. Now, recovery is not just about short-term progress, as I mentioned. It is really about lasting change. And if you want the best support for that, you are more than welcome to apply to my program and then see if you qualified. If you're looking for quick, short tips and tools, keep watching my YouTube video. There are so many of them, absolutely, and that will help. And when you are ready to get that support that you need through the coaching, then I'll be waiting for you. The link is in the description and you know what to do. Just click the link and then go through the process of application. Well, thank you so much for watching this video and I will see you in the next video.